A new high-risk breast cancer clinic at the Banner MD Anderson Cancer Center is dedicated to providing preventative care and coaching for those considered at high risk of developing breast cancer. It's the first such facility of its kind in Arizona. And to learn more, we welcome Dr. Jean Catherine Zhao. Good to have you here, Dr. Zhao. Thanks for joining us.
Me.
Yeah. So high-risk breast cancer clinic.
Yes.
What exactly are we talking about here?
Yes, and our clinic is dedicated just to take care of women who have higher chance of developing breast cancer in their lifetime.
So what kind of services does the clinic provide?
We provide pretty comprehensive cares in high-risk breast cancer patients, and to define the high risk, and anybody who have higher risk of breast cancer in their lifetime, more than 20% are considered high risk, that may need more frequent screening and more care to this specific population.
I was going to say, when we say high risk, I mean, what does high risk mean? Is it people who already know that they're at risk, people who may be and want to find out if they're at risk? How does that work?
Yes, and so breast cancer is one of the most common cancers in women, and 1 in 8 women develop breast cancer in their lifetime. So that's average about 12 to 13%. But if you have other family histories or personal histories or genetic mutation that carries, that may put you in a higher risk of developing breast cancer. If your risk of lifetime developing breast cancer higher than 20%, and then you're considered higher risk.
So basically, the initial appointment, how does that work? You go in, you're not sure, you're a little worried, but you're not sure. Maybe there's a family history, but you haven't had any problems yourself. What happens?
Correct, exactly. So if you think that you are at higher risk because of all family history or genetic mutations, you come in and sit with us, and so we have a provider take your personal history, family history, and then we calculate your lifetime risk of developing breast cancer. If you meet the criteria, you may benefit from more frequent screenings. For example, on top of annual breast cancer annual mammogram, you may qualify for for MRI screening every year.
Okay, so basically you go in for the exam, you're assessed,
right.
And because of that assessment with the clinic, you either move on or maybe you move away because the assessment says you're not at high risk.
Correct, yes. Yeah, you put your mind at ease.
Yeah, I would say so. An integrated approach to preventative screening is what it's described at. Preventative screening is huge, but an integrative approach, I don't understand. What does that mean?
Yeah, there are some factors you can change. For example, lifestyle modifications. There's certain screening for pancreatic cancer related to certain gene mutations. We have certified genetic counselors in the program. We have certified nutritionists, so we can coach you the lifestyle modifications.
Interesting. And this differs from other cancer clinics in what ways?
Our clinic is more focused on breast cancer, and we do in the MD Anderson, Banner MD Anderson, we do have high-risk GI clinic and other cancers, but our clinic is more focusing on breast cancer population.
And I would imagine focusing more on preventative measures too.
Correct. Preventive measure mean more frequent screening, lifestyle modification, the coaching, and maybe put on medication to prevent the cancer developing in the future.
Is there medication that you can go on?
There is a preventive medication, for example, tamoxifen, that will decrease the risk of getting real breast cancer. Yeah.
And I read that the clinic is made up of a multidisciplinary team. That means folks from all different kinds of cancers, all different kinds of studies?
Well, in our clinic, we're focused on breast, so we have providers focusing decrease the risk for getting breast cancer. And if you have known genetic mutations, we have genetic counselors to get tested. And if patients opt to have this medications to decrease the breast cancer, and we can prescribe these medications. And some patients even want to do preventive surgeries to have mastectomies. We have very experienced breast cancer surgeons to have these services.
And everything is based on research. What can you tell us here, Doctor, about the latest research regarding breast cancer and advancements?
For high risk or breast cancer in general?
Both.
Okay. for high risk, we have more and more data coming out, and we're seeing that even preventive medications, for example, tamoxifen, there's trials talking about baby TAM and baby tamoxifen, lower dose of tamoxifen for shorter period durations still have efficacy to prevent cancer. For breast cancer in general, we have more and more medication available in this field. For example, antibody drug conjugated, those are some kind of newer medications, have linked the chemotherapies in the targeted molecules, and they have very good results for breast cancer treatment.
Wow, it sounds so complicated. It must be working. Dr. Zhao, thank you so much for
You're
joining
very
us. This is
welcome.
great information.
Thank you for having me.
Good to have you here.